Good morning, Dr. Steve Dudley with Profectus Livestock Solutions. We're here this morning to talk about toe abscesses. Toe abscesses are a problem where cattle wear their sole down and then bruise the sole and end up with an abscess. What we have to do is remove the pressure from the pus that builds up inside the hoof. So we're going to be talking about techniques that you can do on your farm to take a look at this. So we'll take a look at some cattle that are typical in how they walk that give you an idea, and then we'll show you a couple different techniques where we can open up the toe to release the pressure. Let's take a look. As you watch them walk past, you can appreciate the severe pain that they're in, and when they step down on the pressure with those toe abscesses, it's a lot of pain. You'll notice as you're looking at these cattle that there's very little swelling to the foot. So we have to rule out foot rot, hairy heel wart, and injury as a potential issue. As these cattle walk by, you'll see that they can step on it, they just don't want to. Most of these cattle are a left rear. I tend to see cattle that have this issue tends to be from trucking or from handling, where they sometimes are wild, wear that outside sole down, and then they bruise their foot on a cleat. This white calf in front of us does have a swollen right rear as opposed to the other ones. Okay, as we put these cattle into the chute, it's critical to note which leg is lame. One of the things we're going to talk about here is you got to be able to access the back of the calf. So I'm going to come on in. We've got two ropes behind here. We're going to pull one rope up to the top here and one rope to the side. And safety first, you don't want to get kicked. That calf's quivering, which you can really appreciate how painful that is. So hold that over there. Okay, we've got one foot pulled, or one rope pulled back, one rope pulled to the side. As you look at this foot, you can see this outside toe is just a little bit swollen. We've got a couple techniques. One, we're going to just clip the tips of this toe, and you can look and see the pus coming out right here, and that's all we're going to do. That will immediately release the pressure and immediately release the pain. This calf, when he comes out, will be significantly more sound. So as you look here, I've clipped this one, and on this toe, I'm just getting blood. So if you get blood, that's as deep as you want to go, and there's no abscess on this one. Here, you can see the pus coming out, and that will immediately give relief on this calf. We can go ahead and take that one, loosen that one up. Again, we're looking at this foot. Again, this one has a little bit more swelling, and I see a little bit of discharge but there's no foot rot cut down the middle. But here again, we're gonna clip this toe. On this calf, again, we do get pus coming out. It's not as dramatic as the other one. Actually, here comes the pus out of this inside one. So it is important to check both of those. So this one actually was, I'm going to open that up just a little bit more. You can do also use a grinder to open up some of these. You can see that little bit of opening really caused that pus to flow to that inside digit. So this one looks more swollen to me than, so whichever one's swollen is what I do first. So that one's just about to come. I'm going to grind those down just a little. So as we grind those down, this one is blood coming through. Here I do get some pus coming, so I'm going to open that up just a little bit more. So this one's a little more chronic. I didn't get quite as much pus coming out, but when I push on that, you can see that it's open. The key to this, to be safe, is to have the foot well restrained. So I like one rope here, one rope to the side. Okay. Sometimes I'll use a hoof knife. So if you look at this foot, the outside rim has been worn off. And again, as cattle get a little wild, they skid themselves on the cement and wear that down. So a lot of times that is what will create the opportunity for, then when they're stepping on a cleat, they bruise that inside toe.
Easy.
So this one is, as you look in here, here's our pus on the medial. I got a little deep, so I've got some bleeding here. It's not ideal, but I'm not going to bandage it. And this will heal up just fine. This is a little more chronic. It's not as fluidy pus, but you can see the pus there as well.
Yep.